with any new technology, it is a very valid concern, especially in healthcare, where we always work to the highest safety levels. And so there has been and always will be a very robust, meticulous plan to roll this out in terms of the organization, but also the training of individuals. With regards to the remote side of things, that is an added dynamic and dimension that clearly will increase anxiety. And it is an evolving and dynamic, cutting-edge technology that we are actually very privileged to be at the forefront of globally. And so there are all sorts of controls in place. And in particular, during a proof of concept phase, we have a dual team, so a surgeon and trained scrub nurse in Gibraltar on hand in case there are any issues with the remote surgeon or the connection in between. As time goes on, and this is discussions that we've actually been having, the technology will develop to a stage that one, there may not be a need for those expertise here, or secondly, it will come as a package in terms of a world global leading surgeon doing your operation from afar with the backup of a second sort of fellow or training surgeon under them, competent to do the operation, but not to that world-class standard of someone who's done 10,000 of these operations.
The robot is an example where the whole GHA came together to work together. So our IT team came together, our infrastructure team came together, and you see everyone working towards a project to the highest standards, because obviously we had to meet our own standards, but we also had to meet, we did this in partnership with a UK institution, so we also had to meet their very robust standards. So this is one example of everyone coming together to actually produce groundbreaking results.
Did you have to bring some of the stuff up to a certain standard before you could start offering the surgery here?
Yes, the short answer is yes. Every robotic platform has quite clear guidelines on how you bring a centre up to the required standards to operate on their machinery. And as I've said before, that includes quite a lot of training, both simulation and online, but also through physical wet lab training, and training for all the staff involved, not just the surgeons. And you sort of have to gain those competencies before you're even allowed to go anywhere near the machine.
The major benefit here really is the patient experience. So we have to look at both factors. We have to look at the financial viability of the project, and obviously we'll save on people going over and the accommodation whilst they're there. But if we look at the most recent example, a patient that would ordinarily have taken 2 weeks to recover in a hospital bed took 2 days to recover, and they were up and home in Gibraltar 2 days later. The fact that you've also got to factor in there is that saves on the hospital beds or the additional nights. So there are numerous savings, as well as significantly enhancing the patient experience.